Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. Look, I got two of the most important things for you to think about and plan for when you go to file a claim. Whether it is your first claim ever, or if this is your seventh claim, or you're filing for an increase or a secondary condition or what have you. There are two main things. Now, obviously, there's building blocks on each one of these things. It's not just one thing. It's one thing that's built up by a few things, right? But two pillars that you really need to focus on. And I'll be honest with you. Many people who are veteran advocates, I'm trying to think of the best way to say this stuff. So many of the folks out there like me who are veteran advocates, right? We are pushing to get information out and get people into the VA system and get them service connected. Many of the others don't spend any time or much time on this second piece that I feel is probably the most important. Well, it goes hand in hand with the other one. That's why I'm doing two. So there's two majorly important things. So hit the thumbs up for me, subscribe, share with a friend, all that good stuff. I really appreciate it. I'm going to jump into it. If you're not a member, consider joining. It helps the channel, and you get a little icon next to your name. So in the comment section, it makes it easy for me to find your comments or questions and what have you. So thank you to all the members. I really appreciate each and every one of you, and I'll be pushing out a video for you guys here very shortly. All right, so let's jump into this. The two most important things, and I'll dive into each one of them and just spend a couple minutes on each one to kind of give a nice, well-rounded kind of explanation of what I mean. Number one, and again, whether you are filing a claim for the first time, you're filing a claim for the seventh time, you're filing a claim for secondaries, or filing for an increase, it doesn't matter, right? So you're filing for disability compensation one way or the other. In doing this, there's two things. Well, okay, here's the caveat. If you're already service connected, then the first one doesn't apply, right? So if you're filing for an increase, you're already service connected for that condition. You're just looking for an increase. So for everything else, you need to have the service connection piece. So that's the number one. Number one goal, most important thing, is get service connected. A lot of us out there who are, sharing information kind of stop there. Like, let's get your service connected. Yay, you won. The next step of that is you should also equally focus on getting the appropriate rating. Now, many people think that this is just some sort of fantasy, that how can you know what you should be getting rated, and what can you do to get rated what you should be rated, even if you knew, right? It's all there. We have access to everything we need, but two things happen. One, either A, we're not aware of it, we don't care, we don't look, or whatever it is, right? For some reason, we don't see it, right? Whether it's you don't know about it, or you don't actually spend the time to figure it out. Whatever it is, doesn't matter. You don't know what's out there. And so the second reason why it doesn't happen is we don't spend the time to actually implement the pieces that we need, because we think it's going to take too long and we're excited about filing our claim. So many of us, once we actually decide to file the claim and we think we have enough information, evidence to file that claim, we just jump into it and we file the claim because we want to get the ball rolling. And we miss out on some vital steps, in my opinion, that could, I guess, mitigate some heartache later. Like when you get a 0% rating, but really you should have been a 30, or what have you. So here's the two things. I'm going to jump first on this service-connected piece. In order to be service-connected for a condition with the VA, for VA disability compensation, your monetary benefit for your bad back, your bad knee, this, that, whatever, your heartburn, GERD, your migraines, whatever it is, you have to have three things. The first is you must have time in service, and you must provide evidence of your time in service and eligibility for VA disability benefits. So meaning that you don't have a bad discharge, right? So dishonorable type discharge. So you need to provide your DD-214 or DD-214s. And when you do that, it also gives them a time frame in which to look at. So your entry date and your exit date. That's your window of opportunity for the most part. There's exceptions to everything. Next, the second piece is you must have a diagnosed condition. Many of us say, I have X. We self-diagnose, we file a claim for X, but we've never been diagnosed for it, and we don't provide any evidence of that condition. So the VA gets that, and they think to themselves, well, why am I even going to spend any time on this? I can't spend any time on this because there's no condition. You're just saying it. There is no condition. So that doesn't really count. Now, there are some exceptions where maybe you were a artillery and you say that you have tinnitus, and maybe the VA might kind of wind you through that and just deal with it in the CMP and move forward. But for most cases, you need to provide the diagnosis. Now, guess what? That diagnosis has to have some sort of credible longevity issues to it, right? You can't say, I had a sinus infection that went away and I never had it again, or I had a urinary tract infection and it went away, or I had a cold and it went away and I never had an issue again. You're not going to get service connected for those because they went away. Your condition must be chronic in nature or have some sort of residual effect, some sort of ongoing issue. So that's the number 2 piece, is that diagnosis for a condition that's ongoing. The third piece, number 3, is a nexus, a link between the condition and your time in service. Now, that does not necessarily mean prove to me that the military caused your condition. That's not what the VA is really saying there. What the VA is saying is prove to me, the VA, that your condition manifested during your time in service, entry, exit, or within 1 year out for some diseases and stuff. But for the most part, that year time, or that time frame of your DD-214, entry, exit, prove to me that it manifested then or is a result of your time in service, right? So it's kind of an either or. Show me that the military caused it somehow, or show me that it showed up during your military service, right? So like migraines, for example, or GERD, gastroesophageal reflux disease. There you are. You join, you don't have those things. 2-3 years in, you start having those things, and then you get out. Well, there might not be anything that's directly the military caused this, but you came in without it, and now you have it, and then you get out. So the nexus, that third piece, wants you to show somehow with evidence that your condition is in that time frame or is a result of that time frame of service. There's all kinds of different ways you can do it, right? Ideally, you actually got diagnosed while you were in. Doesn't happen a lot of times. You may have mentioned it on a annual physical health assessment, PHA. You may have mentioned it on your exit PHA. Your physical health assessment as you're exiting. You may have checked some boxes that said, have you now or have you ever experienced painful joints? Yes. Have you ever, back issues? Yes. Headaches? Yes. Heartburn? Yes. Right? So you may have taken care of a bunch of those little check marks, which at least points back to your time in service, even if you don't have a diagnosis. Now, you still need to provide a diagnosis. So even if you check the box and then 5 years later you got diagnosed, now you have a diagnosis. It's out of service, but that diagnosis shows you have the condition. The check mark shows that you complained about those signs or symptoms or that type of a condition while you were in. So you're tying it back to your time in service, the nexus. Then you could, on top of that, get a nexus letter from your doctor. A nexus letter from the doctor is basically simply stating that your condition, blah, 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 is at least as likely as not, or more than likely, ideally, caused or manifested during your time in service, as evidenced by whatever rationale. And they could even reference your physical health assessment that was signed by, probably in 04 or maybe in 05, who signs off on those. And it's usually a 2 or 3 page form. So that nexus letter helps to establish the nexus, the link between your condition and your time in service. So now with those 3 components, you're now going to get service connected for that condition, right? Ideally. Now, the second piece of this puzzle is you need to make sure that you're front-loading information to ensure that you're getting the correct rating. Okay, hang in here with me. I know this is long, but You knowing this helps you to spread the word to others, and hitting the thumbs up and all that stuff helps to spread it out to others as well. So the next piece, and I'll go quick, is having the appropriate information submitted as evidence for the appropriate rating. You know you better than anybody. You're the patient. You know how bad your signs and symptoms are of whatever condition you have. So if it's migraines or GERD or what have you, right? Let's use GERD for an example. So GERD, a veteran who's not prepared for the second piece, right? The second most important piece, which is getting the rating you actually should be getting. The veteran who's not prepared doesn't prepare, doesn't do anything. They've got all their evidence, all that stuff, the Nexus, all that stuff is done. They file their claim, they're excited. Bam, they get the CMP notice. You have a CMP exam for your GERD in a week and a half. Then you're all stressed out, going, oh my God, what are they going to ask me? And, blah, blah, blah. And then finally you go and you're stressed down a little bit. And then you're in there and you are working with the CMP examiner who's asking you questions, and you're not sure, really even what to say. I mean, you're like, okay, well, I'll just answer them, right? So they're asking you, so tell me about your signs and symptoms. I'm not telling you exactly the questions they ask, but basically, how bad do you think it is? Tell me kind of what it's like. Tell me these different things. And basically all you're saying is, well, it's bad heartburn. It's really bad heartburn. It's, it keeps me up. Bad heartburn. It's pretty bad. It affects my life. It's bad. Sucks, right? Well, sucks and bad and all that stuff is not in the schedule of ratings. That doesn't say, well, if it's bad or if it sucks or if it affects your life. It doesn't say that in the schedule of ratings. So now you're relying on the doctor to change the words that you're saying into actual words that the VA is looking for your rating. So if you're just saying it's bad heartburn and I kind of have some regurgitation a little bit, if that's all you say, you're probably going to get a 10% rating. Now if you say I have regurgitation, I have heartburn, I have pain in my sternum, I have pain that shoots into my arm at times, I have difficulty swallowing, I vomit, I'm fearful because if you can potentially get esophagus cancer in my esophagus, which that would be horrible and life-threatening, and it's really it's pretty intense, right? So you're naming all these different things, right? And if you've lost some weight, you've lost some weight. If you can't, because you're just trying not to eat because it just gets so bad, or if there's blood in your stool or anything like that, right? So as you're naming these different things, now you're actually naming stuff that's actually in the schedule of ratings, and that could potentially push you up to a 60% rating for GERD. Now, the difference, right, is saying two things that are listed in the schedule of ratings get you a 10%, saying whatever it is, 7 things get you the 60% rating. Now, obviously, you have to have those things, but if you have those things and you don't say them, nobody knows, right? Nobody can read your mind and know that you have difficulty swallowing. But anybody who has severe GERD understands that when you're having a bout of GERD, I mean, you can't think about it if you're feeling okay. You have to think about it when it's, up in your neck. It's not easy to swallow. It's not easy to do anything. It's hard to breathe, right? And the pain is horrific. So make sure that you read through the schedule of ratings and read all of the requirements for each individual rating that can be assigned. Whatever one you meet everything for at the highest level, you need to print that out, take it with you to your doctor, have them put that into your medical records at your primary doctor. Take it with you to the CNP exam and share that information with the CNP examiner and give them a copy of it. Nobody's going to care more about getting the appropriate rating than you, and nobody's going to care more about getting service connected than you. So you need to do your part and make sure that you're getting squared away the first time. It's much better to get it done right the first time than to bounce back and forth with appeals, because the person who denied you the first time, or the entity that denied you the first time, they're not really that excited to say we screwed up. So they'll try to sometimes hold firm with their original decision, and then you got to push it to the Board of Appeals and have them undo it, right? So with that, we'll go ahead and conclude it there. Thank you so much for watching. I appreciate each and every one of you. And remember, if we don't take care of each other, something went wrong.